Welcome back to another PCBH Corner. I'm Dr. Beachy and I'm joined with Dr. Bauman. And we have a lot of different topics we're going to be touching on today. So I think that we should probably just go ahead and dive in. All right, so number one up on my list is kind of hearing from your perspective about how do you infuse contextualism into your work in primary care. And obviously, you have to remember that maybe not everybody is well aware what contextualism is. So do you want to maybe give us a brief description of what it is and then how it relates to your work in primary care?
Yeah, now my mind's really worried about being able to actually describe it in a brief way, not going off of a bunch of tangents. I think the idea of contextualism can be summarized in making the assumption that every single thing that someone is presenting with makes sense due to the context that they're coming from. Essentially that behaviors don't arise in a vacuum. So if someone has depressive symptoms, or someone's anxious, or if someone is not doing a good job managing their diabetes because of poor diet and exercise, that those things are largely probably make sense if we actually understood the context from where they're coming from. So we always kind of say this to our trainees and to our BHCs, and when we present, our job isn't necessarily to change behavior. Our job is to find out where the behavior is coming from, what context it's coming from, and to see if we can try to change that context so that behavior no longer makes sense to do within that context.
That's a pretty good explanation.
Was that good? Yeah, I feel good about that.
Do you want to mention something, or is that coming later with regards to the internal context as well?
Yeah, we also, now I would say this comes from Kirk Strassel and Patty Robinson, their work in a lot of ways. And I don't know if this is the only type of contexts that are out there, but we also like to break it down into 3 different types of contexts that we're always assessing for. So the first one is the obvious external context, which is kind of what's surrounding the individual. So this might be social support, this might be family support, this might be access to healthy foods and their living situation, just anything that surrounds them.
So when you say that, say somebody has a chronic condition such as diabetes, and they have maybe their A1C is increasing, and we want to look at treatment adherence as the presenting problem, right? And so you would assess essentially their context to see if there's anything that could be determined where it kind of makes sense why it is difficult for them to manage that A1C and maybe why it's rising.
Exactly, and carrying along that A1C scenario, we know that one of the most predictive things that causes people to change behavior is social support, right?
Right.
So if you look at someone trying to improve their diet for A1C, and if we're going through the contextual interview or some other format to gather the context, and we learn that this person doesn't have any social support, they don't have anybody that they're really friends with, they don't really trust people, a variety of different things, their external context just really doesn't support them socially. We know that it's probably going to be pretty tough for them to change their diet. So rather than in that scenario, rather than trying to really bombard the patient with all the diet things, like, hey, watch out for carbs, do all these different things, make sure we're mindful eating and portion control, which could all be good. I mean, that could all be good interventions.
If it's the right context.
If it's the right context. A contextual intervention might be, hey, what if we build up social support? What if we found ways for this person to connect more with people and to get around people?
Maybe get a friend, somebody that they can kind of go on this journey with. So maybe it's somebody from church, maybe it's somebody from work, maybe it's somebody who's already in their life and they reconnect with them.
Exactly, okay. And that would be an external context.
Or maybe a spouse even, because sometimes a family, as you all know, the family can kind of have their system in place, and it doesn't really always support the one member of the family who's trying to make a change.
We see this a lot with kids, right? That might be trying to make diet changes, that the parents, well-intentioned, not that we have a lot of grace for parents, it's a really difficult thing, but the parents might say, hey, it's their job not to eat those foods.
Right,
and it's like, well, that's not really how human beings work in a lot of ways, right? Not only kids, but adults as well. So that would be a version of an external context.
Got it.
The internal context, going back to the external real quick, the external context, we can gather that information pretty directly. We can, based this on our questions, the contextual interview, we can gather that external context. When we move to the internal context, a lot of this is now going to be us deriving what this is internal context is. And
Okay.
the questions that I like to ask myself is, how does this person see themselves and how does this person see the world? And I derive that based on the information that I've gotten from the contextual interview. So when I ask someone about family, and maybe they talk about certain family members and they leave key ones out, maybe one parent, maybe just a lack of external or extended family members, I will follow up on those questions because knowing that information about how they grew up, knowing that information about any ACEs that were present, starts to make some predictions about how this person might see themselves and to see the world.
So again, we have somebody who maybe has diabetes and they're having difficulty controlling it, right? And maybe they have a mood component, maybe some anxiety as well. And you're going through your contextual interview and you get to basically, it's the third question, family. So tell me the most important members of your family, or who are you closest to? And they go, well, yeah, I have my sister.
Mm-hmm.
Then your brain is already going to be going to probably, I'm assuming, mom and dad. Or if they mention, I'm super close with my dad and my sister, what would your brain then go to?
Obviously, my brain is going, there's a big part that is missing here, which is mom. And regardless of why that's missing, the important thing is for us to know why. Why that's missing. That could be for a million different reasons why that person is missing.
But there could be a clue there.
Exactly. And it could be a clue that really gives some indication about how they see themselves and how they see the world. Because going back to your diabetes, as we continue this on, we have to remember that every single time that we ask someone to change their diet, to exercise, to do something that's for them, we are inherently asking that person to care for themselves. The problem is that we don't ask people oftentimes, does your internal context, what your mind is telling you, does it tell you to care for yourself?
Right, does it support that?
Exactly. So when we think about, diet and exercise, I think oftentimes assume that people, of course, they're going to care about themselves enough to, but if they don't have a context internally that supports that, we're literally just telling someone to do something that probably isn't going to make sense.
Or maybe they want to, they want to take care of themselves. And every time they go to do something, that internal context, those teams, the thoughts, the emotions, the associations, the memories, and the sensations that show up have different messages. And maybe those messages are very similar to what they heard growing up. So in the contextual interview example that we're giving for the person with diabetes, and let's say they're in their mid-20s, again, they leave off mom, and then you ask further and you find out that mom and dad got divorced when they were 4 years old. Mom was in and out of her life and struggled with substance use. How might that then, from your perspective, what kind of hypotheses might your brain say if as a patient in my mid-20s, I'm having a difficult time caring for myself, even though I want to care for myself?
Absolutely. And I think the thing that, in those moments when we start to build these hypotheses, and I think that's a really good word to use, these hypotheses, we always have to check them. Right? We can't when we're talking with a patient just be like assuming it's like, oh, you know what? This person, since they had a mom that used substance use and we can predict some of these other ACEs that are going on, well, automatically they must not care about themselves. Automatically they must have a lot of insecurity or self-doubt. We need to always make sure that those hypotheses are correct and to check those hypotheses. But that's where my mind goes. That a lot of times this individual that has been through these ACEs, most likely they had to fight and survive a lot of times. What's interesting about being a fighter and a survivor, usually that goes hand in hand in that, is a very critical mind. Because you always have to be looking out for the next bad thing that's going to happen. Or you always have to be challenging yourself, like, you got to do better. Because if you don't do better, you're not going to be a fighter and a survivor anymore. And that's a really useful thing when you're going through ACEs and go through difficult things. When you're trying to change diet, though, when you're trying to improve these other things, having a critical mind doesn't isn't so useful.
And you said that, so this was the internal context, and you said that there was three. So there's external context, internal context. What's the third one?
The third one is a more abstract one. I think the easiest one I think to understand is the external context. It's the most obvious. The internal one, I think some people are like, okay, I can kind of see where you're going. The third one, oftentimes people are like, I don't know what you're talking about. But the third one is more about our relationship that we have with our internal and our external context. Essentially, are we aware about how much our behavior is dependent on our internal and external context? So carrying on that situation further, this patient that has diabetes, that they had maybe some ACEs growing up, maybe they have an internal context that's self-doubting.
Yeah, she wants to make those changes, but every time she goes to, teams bombard her.
Is she aware that her mind is telling her that? And is she having a relationship with that internal context that is really fused, that she's really bought into that internal context? Or she's really bought in even into this external context that I just don't have any support, I can't do this. What is that relationship that's there? Because the truth of the matter is, while we can maybe really pinpoint what external and internal context is and some of the barriers that they might be showing, are we going to be able to change them a lot of times?
Yeah,
maybe,
depends.
maybe not.
Or maybe aspects or ripples.
Right, or maybe ripples that might come out later on. The one thing that we absolutely can change is our relationship with them. Can we be more aware? Can we be more observant? Can we be more kind?
So walk me through, you do this all day, every day. What might be one or two things that you would say to me, again, if I'm struggling with my diabetes, I really do want to change, and so we're in the visit and I'm telling you, Dr. Bauman, I've tried to make these changes before, and I want to make these changes, but a week or two in, and I feel like I can't do it.
Yeah.
And so what might be some phrases that you would say to me?
Yeah, I think it's a really good question. I'd love to know where your mind's going with this too, because I'm sure your mind has things. Just that though, I'd be doing that throughout the visit, of oftentimes making predictions about what my mind is saying, asking them what their mind is saying, and using that language intentionally to make sure to show that this is their mind telling them this, not them. It's
right.
their mind that
so
is
that's a
stating
diffusion
them.
exercise.
It's a diffusion just in and of itself, very subtly. Honestly, what I'd probably do with that individual, my mind predicts right now, is to normalize the hell out of the struggle that this person's having.
So you may say something along the lines of, based on everything you've told me in this contextual interview, and maybe using some of that information about the ACEs and the fight and the resilience, yeah, it totally makes sense that your mind is on all the time, because your mind being on, as you were saying earlier, your mind being on is a huge reason why why you made it through, and why you're in a successful situation with regards to survival, and you made it through those tough times. Now we have the context has shifted, everything's shifted, so we have a different issue at hand. So now we have to employ a different strategy, and that's what Dr. Strassel will talk about with rigid rules and applying different strategies. So her strategy, whether or not, again, she was aware of that strategy or not, it worked for a long time. And so, of course, when you're in duress, you go to what you know.
Indiscriminately.
Yeah,
right?
into what worked before. So I often say to patients things like, this is a rigged game. Or we have to pay attention to what our mind is telling you, or making those predictions straight to the patient and saying, so I have a feeling the way, you get started on this, okay, I'm going to make these diet changes, right? And then a few days in, your mind starts telling you things like, well, this is useless anyways. The previous 4 times I tried to do this, it didn't work. And then you can kind of read it on a person's face. They'll tell you if that's accurate. If it's not, they'll say, well, no, I didn't really have that experience. Also good information. But if you're if you're hitting the nail on the head, is that how you say it?
Yeah, absolutely.
Nail on the head right there. Then they're like, oh my gosh, how did you know? So then that lets you as a clinician know you're onto something and you're cued into what that internal context is. And then by us talking about it, that naturally shows how it obviously makes sense, because how am I going to be able to read her mind if this wasn't what minds did?
Exactly, and that's, I think, the really important thing, because a lot of the times we're saying, it's like, how do you know? How do you know that? It's like, well, I'm not a magician. I'm
right,
not a mind
this is
reader.
just what
This is
minds
how our
do.
biology, this is how our evolution has created us to be. I mean, this is what has produced human beings right now. That's how we know that this is what your mind is saying. And I might say to that individual, in addition to all the things that you said, I might say things like, it would be weird if you came in here today and your diet was awesome. It would be weird if you would come in here today and your exercise was just off the charts. Because based on base rates,
right.
based on what we know, that's not probably what that context is going to produce. It's probably going to produce what we're seeing right now. And then I think I would say, and I this is one of the things that always, I enjoy doing and working with patients so much, because when we get to see people for who they are, and I often say, it's a corny quote, but I think the greatest superhero power that we could have is to be able to see ourselves through someone else's eyes. And I know how their eyes and their mind is seeing them, which is you're failing at all these things. You need to be doing
Tried
so
it
much better.
before, it
Tried it
didn't work.
before.
It's going to be the same thing this time.
No point. Where my mind sees, or my eyes see, is I don't know how you're doing what you're doing right now. And that's where I love coming back to that original question, why context within primary care? Is because it allows us to see people for who they are.
Right.
Rather than us focusing on, right from the beginning, symptoms and diagnoses and all these different things. It allows us to say instead, what if I learned about this person? And then if my mind starts to predict that the symptoms and the problems and the behaviors that we're trying to change make sense within it, it's like, well, wait a minute. We got to shift course and to work with these other things. So that's the thing that I really enjoy. I'd love to know what your mind says. Like, why context in primary care? Like, why do you feel, what benefit do you feel that this approach allows you to have with patients? Why is it something that you promote? Why is it something that we're both passionate about? Why do you do this?
I actually thought the way you described it was extremely eloquent, and so I'm not even going to begin to try to mess with that. I will say...
Let's always mark that down that she said that.
High
praise.
As a clinician, I'm going to take a slightly different spin on that. As a clinician, it tells me that I do not have to have all the answers. It tells me that I can go into that room. My only job is to learn about this person. Of course, I have whatever the years of behavioral science and tools, and all those things are really important. I'm not saying to skimp on those. But I've already done the work on that. So if I'm getting called into that room right then and there, it's probably not something I can just now do to get prepared. That's why you trust the process and you trust your training. And you go into that room and you trust the process of the contextual interview, that the patient will tell you what you need to know. But they will only tell you what you need to know if, again, you bring in that curious mindset. And how you said, it's like you're there to know them. And when you do that, they give you so much fodder for interventions. It's not even funny. Like, if we want to look at it from that perspective, I think it's just like anything in life. You know, if you give to charity because you really want to feel better about yourself, it's not going to work. But if you give to charity because this is super important to you, and then you have the dividends pay on it. Same thing in this case. Like, I really am going in thinking, how am I going to know this patient?
How am I going to see them?
How am I going to see them? And when I do that, sure enough, the dividends are paid with regards to the intervention that's served up on a platter. And in most cases, nobody panic if you did everything and then you don't have a clear direction. Sometimes that happens too.
And you know what's interesting about this approach is that I think a lot of times when people hear this, they're like, that complicates things a lot. Like,
right.
It's like, whoa. In 20 to 25 minutes, you want me to know who they are, you want me to see them and to gather. And as we always say, you know, the contextual interview is a lot like the polling we do for elections.
Right.
That we're never going to be able, before an election, ask every single person who they're going to vote for, right? So instead what we do is that we get a sample and we try to start to make some predictions. And that's what the contextual interview is. It's a sample. We're never going to be able to understand the person completely. We would be...
and patients understand that too.
Exactly.
You know, they don't expect us to have everything. They give you credit for trying.
And I might even make that comment of saying, like, I'm sure there's a lot more to this story than what we touched on today, and just acknowledging that.
Right.
But it provides, so, you know, there is some additional complication to this. I will also say, though, for me, it has simplified things.
It simplifies it for me.
Whether it's diabetes, whether it's hypertension, whether it's depression or suicidality, whether it's anxiety or trauma or whatever, taking this approach, because it's all about context and where this is coming from.
Give me any chronic condition, and I'm going to do the contextual interview, right? I'm going to do that contextual interview, and it's going to put everything in a perspective, into a viewpoint. And then, of course, like we said, we have our years of behavioral science in our toolkit. You can pick and choose what's going to make the most sense based on what they give you. So
it's a really good point, because it's not to say that we want to do something like maybe some diet education or deep breathing if it makes sense.
If it makes sense.
Context.
And sometimes they do it for you.
Yeah.
So they already start saying, well, hey, I started meditating, or I have this app on my Fitbit, and it has me check in with myself for a couple minutes every hour, or every few hours I have it set. So if you go in, just think about how invalidating that can be. A patient's making all these changes in their everyday life. And then you have some quote-unquote expert come in and just start telling you what you should be doing, when it's like, yeah, I'm already trying that. This has so many benefits. I truly feel that you can't afford not to. So in the beginning, yes, it might complicate things, but that's why you need repetitions. The more repetitions you get, the more you see it. So
learn it, do it well, then become efficient. And that's the one big one. Hopefully our screen's going out here didn't mess anything up. But as always, we appreciate you joining in. Like the video, leave comments on the video, subscribe to our YouTube channel. We always love people reaching out to us and you all getting updates about new videos, but we hope you enjoyed it.
And I definitely want to thank Dr. Bauman for this one because this is a difficult topic to put into words. So thanks for watching. And if people want more information about contextualism and the philosophies that we're talking about, look no further than acceptance and commitment therapy and focus acceptance commitment therapy. And check out the Association of Contextual Behavioral Sciences website for even more information.
Boom. I tell you what, if this is not recording,